Hi, I'm Dagmar Velez, Healthcare Data Analyst at CIVHC, and I'm here with Ashley Heathfield, Senior Project Manager at the Office of eHealth and Innovation. And we're going to present over the telehealth equity analysis to help understand the impact of social factors on telehealth use. So our agenda for today is to, Ashley will present what Office of eHealth and Innovation, their telehealth efforts, and I will present over the telehealth equity analysis and show you a little preview of it.
Thanks, Dagmar. So yes, I'm Ashley Heathfield. I'll talk a little bit about the Office of eHealth Innovation and our work. So a little bit about our office. We were established in 2015 through an executive order responding to the need for statewide health IT governance and coordination. So we're housed in the Lieutenant Governor's office, and our team is responsible for defining, maintaining, and evolving Colorado's health IT strategy concerning care coordination, data access, healthcare integration, payment reform, and care delivery. To ensure these efforts align with the wants and needs of Coloradans, OeHI has created and adheres to a health IT roadmap, and we have our beloved eHealth Commission made up of experts across Colorado's health IT landscape, which advises on our direction and steers the roadmap efforts. So the roadmap identifies 3 major goals to guide our work, and that includes that Coloradans, community partners, payers, state, local, and tribal agencies all share data and have equitable access to needed health and social information, that Coloradans can access high-quality in-person, virtual, and remote health services that are coordinated through information and technology systems, and improving health equity through inclusive and innovative use of trusted health IT and digital health solutions. As such, OeHI has done a lot of work in the telehealth space. Part of that effort is improving our understanding of how telehealth is playing out in Colorado for patients and providers. So I'll share just a few examples of this work. Our team partnered with Colorado Health Institute, or CIVHC, to examine the value proposition of telehealth services in light of the COVID-19 pandemic and Colorado's rapid transition to virtual care delivery. So CIVHC used key informant interviews and electronic health record data to answer key questions related to utilization and access, outcomes and quality, and provider and patient experience. So then to dig more into provider needs for providing services via telehealth, OeHI partnered with Prime Health to establish the Regional Telehealth Learning Collaboratives in 2021. Through this effort, we were able to listen to hundreds of individuals and dozens of organizations statewide, hearing about telehealth reimbursement issues, the need for coordinated resources to support the implementation of telehealth, and what providers recommended for an equitable, impactful, and inclusive statewide telehealth infrastructure. OeHI worked again with Prime Health on a survey to dig more into provider barriers and facilitators for telehealth use. So an initial survey was disseminated in 2021 and was followed up by another one in summer 2022. So the wealth of information gathered from these survey responses has and will continue to be leveraged to inform future decision-making in support of advancing equitable statewide telehealth access, adoption, and sustainability. So the result of these and other efforts helped OeHI and other stakeholders in Colorado better understand the barriers patients face in using telehealth, as well as the barriers providers face in adopting, implementing, and sustaining telehealth care delivery. For patients specifically, we find that the lack of reliable, affordable internet was and continues to be the most reported barrier, followed by access to technology and digital skills. As we look beyond the pandemic and the lessons learned from earlier work, our office is focused on furthering the state's understanding of what is needed for all Colorado communities to have the ability to benefit from telehealth, how to support Colorado providers in sustaining the delivery of telehealth in addition to their in-person services, and how partnering with other state agencies and efforts will lead to more equitable access to telehealth. And so that leads me to the Telehealth Equity Dashboard, which is a project I'm really excited about. So telehealth utilization, exploded during the pandemic, but who is and isn't adopting telehealth in Colorado is unclear. Telehealth can be a tool that increases access to care for communities, but it can also unintentionally widen already existing health inequities. So OeHI has partnered with CIVHC to create a dashboard to marry telehealth and in-person care utilization data, as well as social determinants of health data, with the goal of better understanding inequities in healthcare access, and in turn guide more strategic interventions and programming to create more equitable access. And so with that, I'll turn it over to Dagmar to dig further into this project.
Thank you, Ashley. So I'm going to go briefly over what's included in the Colorado APCD. We have over 1 billion claims dating back as 2013. We include commercial, Medicaid, Medicare Advantage, and Medicare fee-for-service data. And we have over 70% of covered lives. We do not include federal programs, uninsured and self-pay claims, or the majority of ERISA-based self-insured employers. So the goal of the telehealth equity analysis was to explore the relationship between telehealth utilization and social factors to ultimately improve health equity and access to critical services for marginalized populations. We used both claims data from the Colorado APCD and social factor variables from the American Community Survey database. In the analysis, we included years 2021 and 2022 combined, and in-person codes that could have been performed via telehealth and telemedicine. The utilization was, or the claim rates were per 1,000 people, and we used all payers. And the socio-demographic variables that we used were all from the American Community Survey data. And those ACS variables are all included here. Some were percentage of people within a tract that had these factors. So percentage of people within a tract with limited English or without a high school diploma. And then we had others that were percentage of households within a census tract that, for example, didn't have a vehicle or internet. And here's a screenshot of what the dashboard looks like. So at the top, we're going to have a map, which you can zoom into each individual county to see the distribution of the measure that you select within a census tract. So each color reflects those ACS variables or the claim rates that you select. Higher meaning darker color, lower meaning lighter color. And then on the right, you see the distribution of race and ethnicity data within the county. And then you, as you can see on the top right, you can select those either claim rates or ACS variables that we talked about previously. In addition to the map, we have a table that shows those exact percentages for each census tract. And at the top, you can select both for the map and this table, which county you're interested in. You can sort by those individual measures that we looked at earlier, and you can select the sort order. So for example, if you're interested in the census tracts in Colorado or here Adams County that have the least number of claims rate, you can do so and then see those other, how those other percentages of the measures compare. And at the very top, you see that we have statewide measures, so you can do a comparison of how does the census tract compare to the statewide percentages. Another part of this dashboard is the scatter plot, where each dot represents an individual census tract. The x-axis represents the claim rates for either telehealth or in-person, so you can see side by side how those differ. And then on the y-axis, we have the measure, those socio-demographic measures that you can select. And then the R value, which identifies the strength of the relationship between the social factor and telehealth or in-person utilization rates. And then I'm not going to go over this in detail, but these next few slides just goes over a previous telehealth services analysis that CIVHC did in the past, which shows a really in-depth look at the utilization and spending for various telehealth services from 2020 or 2019 through 2021, and the results that we saw from it. So it was really interesting if you wanted to look at it on your own time.
And thank you so much for joining our presentation.
Thank you.